Hi, my name is Emma, and I have decided to explore occupational therapy as a profession after graduation. So, a little bit about myself. My name is Emma. This is my third semester here at BYU, Idaho. I am a health psychology major. This is a picture of me and my family um, a month ago when I came home from my mission. It's the most recent picture I have of myself, um, But like the reasons listed in chapter 13, I'm studying psychology because it interests me the most, especially health psychology, because it's where the mental and physical wellness meets. And that's really interesting to me, seeing patients in their full well being instead of just the psychological or the physical well being. Um, Health psychology also leads well into a master's program in occupational therapy, and it's a job that's in high demand, so it's very likely that I'll be able to find and retain a job directly after graduation. So job stability is a plus. But I also love being able to help people on a more personal level and in an individual way, in which occupational therapy will allow me to do that. Um, So, what is an occupational therapist? We use therapeutic practices to rehabilitate and improve a patient's ability to perform in day-to-day activities. Most practitioners, like nurses or other doctors or even physical therapists, will focus on specific injuries or specific areas of the body that needs healing, while occupational therapists look how that thing is affecting their daily life and how their quality of life can be improved by helping that ability, if that makes sense. Um, yeah, so we evaluate patients a lot. We assess their home and work environments to see how their life can improve through better activities, through making better goals for themselves. We develop treatment plans and train personal assistants, care workers, other family members of the patients to help them carry out those treatments and those therapies. Education-wise, you need a bachelor's degree in a psychology, biology, or other medical, physiological related field. You need to take your GRE, and then you'll either take a master's or doctorate's degree in occupational therapy. You need to have a master's, you don't have to have a doctorate. There's more universities, more colleges that have accredited master's program in occupational therapy, and that's all that's required. And then after graduation, you need to take um, the NBCOT, which is the National Board for Certification in Occupational Therapy, which then gives you a national license to be an occupational therapist in the United States, which then you are able to work as an actual occupational therapist. As far as this fitting into my 4-year plan, it fits really well. This is something that I've wanted to do since I graduated high school, and it's just gotten more and more interesting as time goes on. I plan on graduating in about 3 years with my bachelor's degree and going to Idaho State for that master's in occupational therapy. The most important thing is to be aware of those prerequisite courses based on those master's programs. Each one is a little bit different. Each university requires slightly different classes. From what I've seen, a lot of them are biology based classes, so you just have to make sure that you're taking those accredited courses. Yes, occupational therapy is very interesting. I'm excited to study more and eventually become one. Thank you.